A little over a week ago I kissed the top of our 5 weeks old baby's head. It was a single, light kiss and she had a thick head of hair with no obvious scratches or other skin imperfections. But I had cold sores on my lips at the time. We have been really careful to avoid giving our children cold sores or otherwise pass along the herpes virus, HSV-1. We have maintained a strict no kissing on the lips or face rule between everyone and our children, and I do not kiss my wife on the lips or other regions while I have cold sores. But just a few hours ago our 5 weeks old baby was diagnosed with HSV-1. She developed sores starting from where I kissed the top of her head within 24 to 48 hours of the kiss. We weren't sure what the sores were initially, so we brought her to a walk-in medical clinic for assessment. They took a swab sample for testing and provided a prescription for topical, skin-applied, antibiotics while suggesting the sores could be due to a bacterial infection. But after 48 hours the sores were continuing to grow and spread across the top of her head. So we phoned the clinic and our family doctor, but they still had no test results. They then provided a prescription for oral antibiotics. But after 24 hours the sores were continuing to grow and were now across her forehead. We still had no test results, so my wife took her to our family doctor. But our family doctor did not know the cause of the sores either and suggested we take her to the Children's Hospital Emergency. We took our baby to Children's Emergency that evening. They took a look at the sores and listened to our concerns. They also took swab, blood and urine samples to try to determine the cause of the sores, bacterial or viral, and to determine if it had spread to other organs or systems. They tried to take a sample near the spinal cord as well to check if it was in her central nervous system, but they were unable to collect what they needed due to her small size, 10 pounds, and movement during their attempts. While waiting for the results from the hospital, we were informed that the test results from the walk-in clinic showed only a culture of normal skin bacteria. But the hospital staff told this could be due to them collecting the sample from the surface and not opening up the sore to collect. She was admitted to hospital and started on 4 antiviral and antibiotic medication. After spending 48 hours in the hospital we were informed that she has contracted HSV-1 and that the sores may reoccur in the same region it started originally, top of head, or around the mouth. Different infectious disease doctors gave varying options on where the sores may appear in the future. They told us that she will need at least a week of 4 antiviral as she is too young to take oral antiviral. My mom was infected with HSV-1 when she was in grade 6, likely from her dad, and was hospitalized for a month. Apparently they thought at the time that she would die from it due to the severity of the response. And my older brother and I both were infected with HSV-1 around that same age or younger from our mom, but we have had only recurring cold sores with no other major symptoms. I seem to get cold sores almost exclusively when I have a lack of sleep and thus put stress on the body, leading to a compromised immune system. Now our little girl has them despite our best efforts, and it breaks my heart. We are concerned about it now being easier to spread to our other children, and the possibility of it spreading my wife's breasts, which would affect her ability to breastfeed. Especially concerning if we have more children in the future. And I have found cold sores to be a cause of physical, emotional and social discomfort in my own life, so I am very sorry to have passed it along to my daughter. I had no idea that HSV-1 could be spread through contact with skin. Growing up I only heard of it being through mucous membranes, lip-to-lip kissing, sharing cups and utensils, etc., and a few years ago I read that it could spread to breasts or genitals despite not being HSV-2, genital herpes. Looking it up online now, I am seeing that they suggest not kissing babies under 28 days to avoid causing neonatal herpes. But what I was reading did not make it clear that kissing any part of the baby could spread the virus. The doctor stated it is possible to spread through kissing the top of her head, but prior to diagnosis said he would be surprised if it was HSV-1 because she was not under 28 days, she was 5 weeks at time of kiss. She was full term, healthy weight with no complications during pregnancy or postpartum. According to the info I found online, herpes on an infant or child can have life-changing consequences aside from the sores, such as blindness and brain damage, and can often be fatal. Apparently the majority of the general population likely has herpes, but a lot of people are asymptomatic, i.e., have never had any cold sores. And herpes can be spread within the body or to others whether or not there are sores present at the time, although it makes it more likely to spread to others if there are sores. My wife informed of a case. There is at least one article online from 2008 regarding it, where herpes had spread to an infant and they were hospitalized. But a week after the infant's sores were no longer present, the baby died due to the virus spreading within the body. So I am sitting here in the hospital full of regret over that single kiss, and hoping that she is able to make a full recovery. But I am glad that she did develop visible sores and that I suggested along the way that the sores could be due to herpes, because they were able to diagnose and treat the virus relatively early, which may have prevented it from spreading to other regions of the body. I am also glad that our baby was healthy on seemingly all account prior to this incident, because it would likely affect her worse had there been other compromising factors. And I am hopeful that effective and safe therapeutic and preventative vaccines for the virus will be developed in the near future. I do not want to cause unnecessary or excessive fear among others, but I want to share my experience and raise awareness of the risk. I wish I knew what I do now a couple of weeks ago. I would take back that kiss in a heartbeat. Edit number 1. I would like to thank those who have shared their support, information and experiences. I appreciate your kind, constructive words and I hope you are doing well. Smile. I would like to point out the following regarding this post. I am not a medical professional. My username was the first randomly offered username by Reddit and I didn't care to change it at that time. I did not mean to suggest that I am a paramedic. What I am and have been explaining is my current understanding based on my own research and experience and those of others who have shared. Patches and medication may be available to you which can decrease the risk of spreading the virus or showing physical symptoms. It would probably be a good idea to talk to your doctor if having herpes causes you to have sores or seek therapy if it causes you depression. If you are reading this at this point in time, chances are you carry the virus too according to some estimates/research. You often need to be tested specifically for HSV-1 to know whether or not you are a carrier due to the majority of people, babies and adults, being asymptomatic, never experiencing sores. Having sores puts you at a greater risk of transmitting the virus to other people or having it spread to other locations on the body, but a lack of sores does not make those events impossible. And its spreading within the body is common for infants especially when left untreated and can often be fatal. One estimate shows a 25% death rate estimated for the United States currently even with treatment, or cause disabilities if it spreads to other organs or the central nervous system. Infants may experience symptoms such as lethargy, exceptionally sleepy or fatigued and sluggish, difficulty breathing, irritability, high or low body temperature, having a larger abdomen size than normal, or seizures when infected with the virus. If an infant experiences these symptoms or what appear to be herpes sores are present, you should contact your doctor or seek emergency services immediately. The virus can be spread through contact with skin on any part of the body, although infection is much more likely to infants, areas with damaged skin or open wounds, and mucous membrane areas, i.e., lips, mouths, breasts, genitals, eyes, noses and ears. The virus can transfer to others without a person touching them directly. Sharing food, drinks, utensils, or otherwise contacting an infected area can transfer the virus. Once infected, the HSV-1 virus remains within the body for life. This may or may not be true for all forms of herpes. Stigma surrounding herpes and its transmission is preventing honest and open transfer of information on the topic. Showing affection for those you love is natural and needed, but should be done in a manner that does not put yourself or them at an increased risk of negative consequences. I kissed my daughter on the hair at the top of her head. She was born with a full head of hair which is still there and she did not have any obvious damage to the skin at that area. I deeply regret kissing my daughter when, as a baby, and where, semi-exposed skin, I did, but I did not know that transmission through skin on any part of the body was possible. My understanding at the time was that active HSV-1 sores can transfer to others when the virus touches lips, breasts or genitals only. I would like to add the following points for added clarity/context. Edit number 2. I do intend on discussing management of the virus with my doctor soon to see what methods may be available, safe, and effective for me in my efforts to reduce the risk of spreading the virus. My mom kissed us on the lips frequently growing up. We would kiss her lips and share drinks with her as long as she did not have an active sore. When I was 14 years old or so I told her I did not want to kiss her on the lips anymore. She expressed her sadness regarding these wishes and said that I must not love her anymore. I do not know exactly when or how I was infected. Cold sores were sort of accepted as being normal within my family, despite my mom's extreme reaction to the virus as an older child. And until recently we had other family members insist that kissing children and babies, including on the lips, is normal and needed and that it isn't a big deal to spread cold sores. When I say that the virus spread despite our best efforts, I do not mean to say that we did everything we could have and should have done. What I mean to say is that we were actively trying to stop the spread of the virus given what we had known at the time. Myself and my wife have done some of our own research regarding the virus at different points in our lives, yet we still did not know what we do now. If the results of my actions which I have shared here is expected to you given the circumstances, I am glad. But my target audience with this post is people who may not have expected what we have experienced. Thank you. My mom did mention she takes similar before and suggested it when I let her what happened. I wish I had done so before this. But I plan on seeing my doctor ASAP to discuss and see what the options are. Update 1. I did not know that infection could occur through regular skin. Growing up I was only taught that it could spread through contact with the mouth or lips, and I only learned about infection being possible to genitals or breasts as an adult. Prior to the kiss, I think I may also have been unaware about the seriousness of infections to babies and was trying to prevent its spread to our children solely based on the discomfort and embarrassment I endured in my own life as a result of developing cold sores. Our daughter was provided with 4 antiviral treatment for 1 week in the hospital before we were discharged. We were given a prescription for 1 week's worth of oral antiviral medication to be taken from home, and had a follow-up appointment with the infectious disease doctor around a week after discharge. Although they were unable to take a sample of spinal fluid to check if HSV had spread to our daughter's central nervous system, they thought that the virus was likely only skin deep in her case. And we were told that we would need to come back to the children's hospital immediately if the sores presented themselves again, I assume at least until she is 1 or 2 years old. Our daughter has had 1 or 2 outbreaks of HSV-1 since we initially left the hospital. The first of those outbreaks was around 3 weeks after leaving the hospital and resulted in a hospital stay overnight, followed by about 2 months of oral antivirals to be provided from home. And the other time was around 1 month after using up the antivirals from the previous outbreak, but the sore went away on its own within 24 hours. We were going to pick up antivirals for the last time, but all pharmacies were closed, so we decided to wait until the morning, but the sore was almost fully gone by the morning. Both recurrences showed up at the same location as the initial sore and kiss, top of skull. My wife met with an infectious disease doctor in February to discuss our daughter's case, and the doctor said that our baby got really lucky. There are limited treatment options, and our baby S case was very minor compared to most. She seems to be a very happy and healthy baby. In my opinion, since she was about midway through her stay in the hospital, she seemed to be in a happier place and is still there as long as she isn't wanting to be held or nursed by her mom. My wife and I both agree that she has been the happiest of our babies. And she is just about to celebrate her first birthday. I have posted this story to a number of different subreddits to try to raise awareness, especially for parents or soon-to-be parents. Many users have expressed gratitude for the posts because they were unaware regarding the dangers of HSV or how infectious it is. So I am glad to have possibly helped prevent some similar or worse cases from occurring. A user also commented fairly recently on an older post of mine suggesting that I share it over and over because they think the information is valuable. So I thought I should do an update post here to help spread the info some more and give an update to anyone who saw my earlier post. /Sudaship, my heart weeps with yours. I had a couple of miscarriages, but nothing as traumatic as a birth like yours that ended so sadly, and I still cry. Oop, I am very sorry to hear your story. But thank you for sharing, and I hope you and your family are doing okay. I appreciate the support. I hope I do not make too many mistakes or ones that are too big, but mistakes are definitely bound to happen. I do hope to make my family proud and want to keep them as happy as I can. Oop, I'm happy to help. And for sure, the shaming and stigma are also certainly a large part of the reason why it isn't talked about more. A student nurse at the hospital who helped our baby said that they are taught this info about HSV in their courses, but he mentioned stigma specifically when explaining why the general public is not being informed. Oop, eventual exposure is one thing, but I would argue that it definitely should be discussed more than it is. Exposure to babies is very serious. Neonatal herpes has about an 85% fatality rate when left untreated, and even with treatment there is currently around a 25% fatality rate in America. It can also cause blindness, brain damage, or their disabilities. My wife also sent me a study a few months ago that showed that HSV is the root cause of some cases of SIDS. We went through the public school system, took pre-delivery courses, had regular doctor visits during and after pregnancy, had 3 hospital births, read the booklet provided at the hospital, and regularly attended a baby group post-delivery. But no one or nothing mentioned HSV at all. Expect maybe the hour or 2 sex ed course they give you in school and just say to wear a condom. Now on to second story. Sister threatens to ruin Thanksgiving with her infamous green bean disaster, despite my desperate attempts to save our taste buds. Every year, our family does a big Thanksgiving dinner, and we all typically bring a dish or 2. My sister, who's a lovely person in every other way, insists on cooking something homemade every time. The issue? She's not a great cook. And I don't mean just not great, I mean she has somehow managed to turn classic dishes into borderline inedible creations. For context, last Thanksgiving, she showed up with her special recipe stuffing that was over-seasoned with random spices like cinnamon and cardamom. It was dry, and the flavors were confusing and totally off for stuffing. Only one person took a small bite, and the rest went untouched. Another year, she brought a green bean casserole that had some kind of strange, chewy texture. She later admitted she used coconut milk and almond flour to experiment. No one wanted seconds of that, either. This year, I'm hosting Thanksgiving. Since I'm responsible for putting it all together, I wanted to keep the menu consistent so that people could actually enjoy a cohesive meal. I thought I'd avoid drama by asking her to bring non-food items instead, like wine, soda, or even some flowers. I explained to her, very kindly, I thought, that I just wanted to make things easy and streamlined, and I'd handle the main dishes. But she didn't take it well. She got offended and told me I was being controlling and shutting her out of the family gathering. She then accused me of making her feel inadequate and said that Thanksgiving is about everyone contributing, not me deciding what's acceptable. I told her that everyone appreciates her effort, but that she could contribute in other ways and still be part of it. She doubled down and said she's bringing her famous green bean casserole whether I like it or not. Now, my mom and a couple of other family members have chimed in, saying I should just let her bring whatever she wants because it's Thanksgiving and it's the thought that counts. They're acting like I'm committing some huge offense by wanting the food to be enjoyable for everyone and not have random experimental dishes that no one will eat. But I feel like I'm just trying to keep the meal enjoyable and, frankly, edible. I don't think it's wrong to want guests to actually enjoy the food, especially since I'm putting in a lot of effort to host. Update 1. After our last conversation, my sister was being pretty cagey about what she planned to make, so I reached out to my mom, hoping she could help smooth things over. Instead, She got defensive, saying I'm overthinking and that it's just one dish. I told her I wasn't sure it was just one dish anymore, especially after hearing about my sister's grocery haul, including canned oysters and edible glitter. Then my mom let slip that my sister has been hard at work on some creative menu she's planning as her Thanksgiving surprise. Apparently, she's been telling the family group chat, which I wasn't included in, by the way, that I'm being controlling and that she wants to expand everyone's palate with something truly unique. To top it off, my cousin sent me a screenshot from the group chat where my sister said she's bringing not one but 3 dishes to Thanksgiving now. She's calling them her Thanksgiving trio experience, complete with her own place set, aims and little menu cards she's designing. I'm officially panicking because I have no idea what she's planning to serve, and from what I've heard, it's not remotely traditional. At this point, half the family thinks I'm overreacting, while the other half is texting me with things like, is she really bringing glittered sweet potatoes? I feel stuck. If I try to control it anymore, I'm the bad guy, but if I don't, Thanksgiving might turn into a tasting event for my sister's avant-garde cooking. So yeah, Thanksgiving is weeks away, and it's already become a family spectacle. I don't know whether to brace myself or just preemptively order pizza. Update 2. Since the last update, my sister has become fully committed to making her dishes the main attraction. She's been dropping hints in the family group chat, which I'm still not included in, but shout out to my cousin for the screenshots, about how this Thanksgiving will be one to remember and calling it her Thanksgiving debut. She's apparently been referring to herself as the Thanksgiving head chef and has hinted that she's bringing some kind of culinary surprise centerpiece that will transform the whole experience. From what I can piece together, she's planning a main statement dish in addition to her original 3 side dishes. I'm picturing something equally bizarre but on a much larger scale, and honestly, I'm terrified. If her green bean casserole was already pushing it, I can't even imagine what she thinks is worthy of being the centerpiece. Then, to make things even weirder, my mom texted me privately and suggested that I step back this year and let my sister shine since she's so excited about her contributions. My mom thinks if we just give her this moment, it'll make her happy and she'll get it out of her system. She even hinted that maybe I should focus on decorations and drinks instead of the main dishes, which feels like an attempt to turn hosting over to my sister without actually saying it. So now, I'm left with a choice: go along with my mom's plan and let my sister essentially hijack Thanksgiving, or keep pushing back and risk a family showdown. I just wanted a nice Thanksgiving with dishes everyone would enjoy, but it seems like I'm either about to hand over the whole meal to her, or prepare for some serious drama. Thanksgiving isn't even here yet, and it already feels like a circus. I'm half tempted to just sit back and see what chaos unfolds, but part of me is still worried about subjecting the whole family to whatever artistic statement she has planned. Maybe suggest that the entire dinner be at either your sister's house or your mother's house. That way you can go and just enjoy the chaos, without having to clean up before or after. Oop, you know what? That actually sounds like a genius idea. If my sister wants to take over the spotlight so badly, hosting at her house would give her all the freedom she needs to showcase her masterpieces without me having to worry about the setup, the cleanup, or the fallout. Plus, I'd get to just sit back, relax, and enjoy the chaos like the rest of the family. I could even pitch it as a way to showcase her hard work without stepping on my toes as host. If my mom's already on her side, maybe she'd even help make the transition happen. At this point, I'm not sure why I didn't think of this sooner. It's the perfect solution for her main character moment and my sanity.